It's not rocket science, dude. The video is the harder part than doing the surgery. Dr. Pelto here, I have a patient. He has a really painful corn between the toe. What's happening is this fifth toe is rubbing against the fourth toe, and it creates this painful callus that's underneath there. And it's been there for years, and it's bothersome. You trim it down and it comes back. So I've already numbed up the toe, that's why it doesn't hurt. And so we're going to explain kind of the treatment for this. One of the simple treatments is to trim down the that callus there. But because it keeps coming back, what I do is I make a little puncture here. And we have this little orange thing on the tip. Any pain?
Nope.
And you go right down to the bone. I can feel the bone. Okay. And what you do is you lift off the skin from the bone like that. So I lifted all this tissue up above the bone, and I can feel the bone with this little freer elevator. Then what we do is we take a little rasp that looks like this, and you rasp down the bone. Any pain?
Nope.
So what it does is it basically pulverizes the bone. And you want to take off enough so that it's going to create a concavity, so kind of like an indentation in the skin in this area. And you know you're in far enough when you go all the way to where that's at. And so now when I push on it, there's a concavity where that big callus used to be. Okay. And all that is kind of pulverized bone in there. Then what I do is I take a little saline and you kind of just try to get out all that stuff that's in there. And then you just check one more time. So it's all nice and soft right in there. So that's going to avoid the toes from rubbing. Now what's the risk of this? Well, one is you shave it right here, so it potentially could rub a little bit further closer or a little bit further away. Less further away, but sometimes closer if this bone on the other side is too large. Okay, but usually this resolves this type of a problem right there. What we're going to do is we're going to put a couple of stitches in here, and then we'll be done. And the only thing that this patient has to do is he can't get it wet for a couple of weeks until the skin heals. And what are the risks of this at this point? Basically, there's a risk certainly of infection is a concern, but we use a nice sterile prep, but there's always risks of that. There's risks of if he gets it too wet, so he's not supposed to get this wet, but if he does get it wet, potentially it could open up, what we call dehiss, like open up the skin without it being totally healed. But for the most part, these heal really well. So everything's nice and closed. That's the tourniquet. You want to make sure you take those things off. And sometimes these bleed a little bit. So we put a little dressing. He's just going to leave this dressing on for maybe 2 to 3 days. And then just put some gauze and a Band-Aid around it. And the hardest thing about these bandages is not having them fall off. And the other hard thing is trying to find the end of this co-band. See? And now you're recording, so you can't even help me. This is my favorite part. Okay, all set.